This is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University, and I'm pleased to provide this week's update on the COVID-19 pandemic for both the world and for the United States for the week of August 9th, 2020. And let me start with a little bit of an apology. Over the last 3 months, I've been providing weekly updates with very specific data, but I've never explained why I pick the data that I do or how you can get those data for other countries or other states. So there's a short companion video that we're including this week, which tells you why I picked the data that I picked. But also in this presentation, I will show you some ways to get the data for your own country that you're interested in or a state that you're interested in. So to go back, we know that this was an epidemic, a pandemic that we learned about in late 2019. But it really didn't explode until middle of March. And then it's been growing consistently ever since. This is deaths worldwide, reported worldwide. And now this week, we're over 700,000 deaths and almost 20 million confirmed cases worldwide. But as I've pointed out before, this is a considerable underestimate because there are many parts of the world where we simply aren't getting reports or we can't get timely reports. But these are minimum numbers. What we are seeing, in the countries that have been most heavily impacted was that after initial growth rates that were very high, the growth rate has been coming down. So this is Belgium, the most heavily impacted country in Europe. And as you can see, from early April, it was doubling, 100% growth rate, all the way down now for several months, a very, very little growth rate. If you turn it over and look at it this way, basically what you see is that they've been approaching 10,000 deaths. They have a very level epidemic, if you will. But other countries look quite different because the world overall, you're seeing the same pattern of drop, but instead of coming out at 0, it's coming out at 5 to 6% a week increase in the number of deaths. And the reason for that, and what we said before, is you have to think of the pandemic evolving differently in different parts of the world. It starts earlier in some places. And so what we see, you have a pattern like this in Belgium, which is a very mature epidemic. The United States is slowing down, but we're not leveling off like that. Brazil is still growing, and then a country like South Africa is growing very quickly. This is not because these countries are doing anything wrong necessarily. It's just that the pandemic is hitting them at a different point in time. So the way to think about the world is these different levels of maturity of the pandemic, ranging from the sort of the level mature pandemic that you see in Belgium all the way down to South Africa and many other countries that are still hitting that early phase. So if you want to see the data for any particular country that you're interested in, I use Worldometer. You can use other sites, but go to this site. It'll show you all the countries in the world that have data. You select the country that you're interested in. Let's say in this case, we're interested in Mexico. What you can see, there have been 475,000 recorded cases, 52,000 deaths, and their death rate per million is 403. And then when you click on the country itself, it'll show you these same numbers. If you then scroll down to the bottom, you can see the pattern that they're having. So you can look up any country in the world that way. And again, the way to understand this is the pandemic did not just suddenly explode everywhere in the world all at once. There were some hot spots, some places that it hit early, places that expanded more rapidly. And so we see these various patterns. We're hoping that eventually this pattern that we see with Belgium here will be something that we start to see. So perhaps the US, which is reaching that level there, is sort of equivalent to this point here, and so on. You can see the differential impact pretty clearly when we look at the list of countries that are most heavily impacted. So a month ago on July 5th, we laid out the 25 most heavily impacted countries in terms of deaths per million, and we color-coded them: white for Europe, pink for South America, blue for North America, and yellow for other. And then we did the same thing this week, and we'll color code them the same way. And then we put them side by side. So that's July 5th, a month ago. Here's August 9th. And there's a couple of things that are pretty obvious, one of which is that the South American countries are moving up on the list. If you look at Belgium, it's still the most heavily impacted major country in the world, but it's only grown about 1% in the past month. On the other hand, Peru, which was down in the 11th place, is now 4th, having doubled in the past month. The U.S. has dropped from 7th to 9th, but in fact has grown almost 25% in the past month. And again, if you look at what it took to get into the top 25 a month ago, it was 77 deaths per million. And now it's almost triple that. So think of multiple epidemics unfolding at the same time that make up this global pandemic. And they're reflected in the patterns that you see in these individual countries. If we look at the United States more specifically, again, our first death was probably in early March, and it went along. And then it was probably about mid-April that our numbers really started to grow. And we've been growing. This is, again, this number of deaths. And now we're at 165,000 deaths and over 5 million confirmed cases. And as I do every week, I remind us that normally in 6 months, we would expect about 100, we would expect these number of deaths from the 10 leading causes of death in the U.S. and the 130,000 deaths from COVID-19, to put it right there. So again, for folks who insist on saying that this isn't a particularly serious epidemic or pandemic in the United States, I think this helps explain that it really is. If you look at number of cases, we had an early explosion, then it seemed to drop and it's been growing, and now it seems to be coming back down fairly consistently. As I've said before, I'm always a little bit leery to use cases. I prefer to use deaths. So if you look at deaths per million every week, early on we were seeing a 25% increase. That means it went from 100 deaths to 125 in 1 week. Then the numbers started to slow down. And we were hoping that it was going to drop pretty consistently, but then it seems to have been leveling off around 4 to 5% a week. So it looks sort of like this. Again, you hope it's going to drop to zero or close to zero, but it's not, in part, again, because there are multiple pandemics evolving in different parts of our country. If you look at deaths early on, we had a spike in deaths. It came down, it came back up, and now it looks like it may be coming back down again. That doesn't mean everything is over. It didn't mean it was over back in April when the death rate started to come down. It's just an observation based on the data. If you look at hospitalizations, again, early on, very rapid increases, and then it seemed to be leveling off and coming down, and then looked like it might be picking back up again this week, maybe down a little bit. So it's optimistic, but again, still not coming down to zero, still leveling off in the mid-5 range. And again, the reason for this is because we're getting the epidemic evolving at different places at different times. If you look at the pattern in New York, it looks quite a bit like Belgium does. Leveling off over time. Virginia is still growing but slowing down. Tennessee is growing more rapidly, and then a state like Florida is growing even more rapidly. I'm not picking on these states, just again showing them as examples of what's happening. If you want to see your state's pattern, go to Worldometer. Click on the USA link right there. It'll take you to all 50 states. Then click on the specific state that you're interested in. In our case, Tennessee, and you can see 120,000 cases, 1,215 deaths, and a deaths per million of 178. And then if you scroll down to the bottom, you'll see your state's pattern. So that will help you compare your state to other states and to the United States overall, and to get a sense of how your state looks in terms of where it is in the maturity of the pandemic. There's a great deal more information about COVID-19 on our college website. If you hit this icon, it'll take you to a lot of short videos. But if there's any specific topics that you'd like me to cover, please let me know. I'd be happy to try to find an answer for you. Thank you very much.